Welcome to the 14th episode of the Startup Strides, previously known as the Java podcast. Today, my guest is Dr. Dora Koller. She is a Marie Curie postdoctoral fellow at University of Barcelona and Yale's University School of Medicine. She conducts cutting-edge research on the genetic overlap between different psychiatric traits and physical health related to chronic pain. She also has a huge interest in contributing to the development of preventive strategies and personalized therapeutics approaches for psychiatric and women's health, recently founding EndoCare Therapeutics, which we'll talk more about later on. And welcome, Dr. Koller.
Thank you so much for having me.
Of course. Obviously, Dr. Koller, this was a very brief introduction. You have a very extensive education and professional background. So I guess my first question would be, can you please tell us about your academic and professional background and your research interests in your own words?
Yeah, so at this point, I think I have more than 10 years of research experience. I think it's closer to 15. And I started it back in Hungary, where I'm from. And I started working in a basic genetics lab, very basic. Already during my bachelor's, I think in my second year. And I was already mentoring other students. And at the time, I actually didn't really realize that it was early to do that. But now I'm happy that I have that experience. And after that, I moved to Madrid and I did my PhD in clinical pharmacology. So I really changed the field. I had no idea about, clinical pharmacology. I was doing clinical trials. I was working with patients directly, and I was doing pharmacogenetic research. So it was a very, very applied project I was working on. And I really, really liked it because I really liked to see how my research immediately affects the patients. So after this, I still wanted to learn a little bit more. So when I went to Yale, I started working with computational genomics in psychiatry. So this was, again, a huge change. I had no idea about anything. So I started from zero. But I quickly started liking it a lot. And I learned advanced statistics, which I think is really, really important. And I think at university, they don't really teach us very well about it. So this was the reason why I really went after it. And I love it. I really, really love computational work. And I'm still doing computational genomics. I don't work in the vet lab anymore. But my science is basically kind of bridging the gap between basic and clinical science, so translational science. And this is coming from my PhD in clinical pharmacology and my basic research experience. But I'm interested in mostly translational research, which I mentioned already, that I want to see the effect of my research in society, in patients, in better treatments and so on.
Before we move on to other questions, I'm curious, usually switching so dramatically, right? Especially later on from wet lab to computational, and computational research is very difficult. There's so much to learn and, all the statistical tools and stuff. How did you manage to navigate that so smoothly?
It wasn't really smooth. So let's start with that. It was really stressful. And every time I changed the field, I thought that I was stupid, actually. So, and now I know that it wasn't the case. It was just I had training in something different. But this is the thing with me, that I'm really interested in learning new things. And this is amazing. But at the same time, it's really hard, because I always have to find another challenge. But I'm really happy that I did all these changes, although it was hard at the beginning. But I worked a lot. That's how I kind of managed. I worked a lot. I studied a lot. I talked to a lot of people. I was listening to other people talking about these methods and so on. And this is how I learned. And I'm usually learning with the job when I'm doing the job. So I'm not so good at just studying, but when I'm actually running a project, or I'm, doing something practically, then it's much, much easier for me to learn fast. So, this is what I did, but it wasn't easy at all or smooth. Yeah.
Got it. You have a significant research focus in psychiatry, which I'm also curious why you really decided to focus on psychiatry, but also you also recently kind of founded a company aiming to develop a non-invasive diagnostic method for endometriosis, which falls under the women's health, right? What motivated you to venture into women's health and tackle this completely new, novel problem?
Yeah, first of all, the human brain and behavior are fascinating. I think like how it works, So that's why I started doing research about psychiatry and behavior. I also worked in an ethology lab, so in an animal behavior lab, working with dogs. I mostly did the genetic research. This is how I started my career. This was my first job back in Hungary, and I really, really liked it. But I'm more interested in human psychology, psychiatry. But yeah, how the brain works, I think it's fascinating. So this is why I started this, and I studied psychiatry in many different ways, right? So I studied it, like as I mentioned already, in an applied version, right? So I was studying the effect of drugs, antipsychotic drugs for schizophrenia, and then like more from a basic perspective. Um, so I'm really interested in this. So how I studied women's health research was coming from my PhD. So first we were measuring hyperprolactinemia in my healthy volunteers who I administered the drugs to. And then I started reading about, prolactin levels, and I found that many women who are treated with these medications, psychiatric medications, they have really high prolactin levels, so they, cannot conceive, cannot get pregnant. So I started reading about women's health in general after I found this, and then I found that we don't know anything. So the research is, like still very much in behind everything else in women's health. So this was really a small problem I was studying during my PhD, but it became big in my head. And on the other hand, I got diagnosed with endometriosis in 2020, which wasn't the best year to get diagnosed with with a disease like this. But I had a surgery at the end of 2020. And of course, like every endometriosis patients, even those who are actually not researchers, I became an expert in endometriosis because care is so bad, and we don't get diagnosed for such a long time that we start doing our own research. And I'm a researcher, so I actually understand everything about it. So when I started doing endometriosis research, I already knew all, like basically literature about it. And yeah, I started reading about how it affects mental health because my main field is mental health and psychiatry. And I found that we don't really know anything about the genetic relationship between endometriosis and mental health. And this was my bridge project. So this was my first endometriosis project, which was between the field of psychiatry, my main field of almost 15 years, and endometriosis. So it's not just from a professional, but also from a personal aspect. Yeah.
I see. Well, what's the main overlap you've noticed between your research in psychiatry and your research in women's health? Like, what are the main?
Yeah, so as we know, like all chronic diseases cause adverse mental health outcomes, and this is actually not surprising at all because I mean, if someone suffers from 15 years of medical gaslighting and pain and all other comorbidities, and then no one understands you, like what's happening to you, no one talks about it because this disease is related to the menstrual period, which is still a taboo in a lot of cultures, actually. So I forgot what was the beginning of the question.
No, it's just I meant like the main overlap between the.
Yeah. So yeah, I understand it from the phenotypic perspective since the beginning, right? But I didn't expect that there is also genetic relationship because, like, these are really different conditions. So I wouldn't necessarily say that there is a genetic relationship, but there is. And in 2021, it was proposed that endometriosis by actually Hugh Taylor at Yale, who's an endometriosis expert. And he proposed that it's a chronic systemic disease affecting the whole body. And until 2021, we were thinking that it's an endometrial-like tissue goes outside the uterus, but mostly it's related to the pelvis area. But now we know that it affects the whole body. So that includes the brain, that includes mental health, right? So I was actually surprised that we found genetic relationship, but now it all makes sense to me, after we actually found that result.
Wow, that's fascinating. And while many skills in science are transferable, right? Like if you do literature review, you do like statistical analysis, it's essentially the same things, like analyzing research findings or clinical trial results. Does the shift in scientific focus pose any challenges? And we kind of like touched upon that, but if you can elaborate, and how do you like adapt and tackle them, right? Like now, obviously, as I said, like the techniques that you use are very common, but then complete shift in focus. Like, how do you navigate that?
Yeah, so basically, like I had the bridge project, which was really helpful. So, which was between endometriosis and mental health. So, it was still kind of in my comfort zone, right? Because I already knew a lot about mental health and that kind of research. But as I mentioned, as I'm an endometriosis patient, actually, it wasn't surprising to me whatever I read about this. I already know it. I already did my research. So, this kind of shift wasn't super hard for me. I think in case of another disease which I'm not familiar with, it would be. But with endometriosis, I actually know that I have endometriosis since a very long time. I would say 10 plus years, right? But I wasn't diagnosed. Like, as you know, all of us have this problem. I went to the doctor and I told them many times that I have this disease, like, please diagnose me. And they were like, no, you don't have it. It's just like, it hurts a little bit when you have your period. So that was it, right? So, but I knew it because I did my research. So I wouldn't say this shift was really hard for me, because I studied endometriosis for a very long time for personal reasons. But as I'm a scientist, I was reading scientific articles, not just blogs, right?
That's very fair. And, we'll talk about your company, which will focus on endometriosis. But before we start talking about that, I'm really curious because, especially as a male audience, I feel like, probably women will know. I'm sure maybe not everybody, but most of, I would say, like, personally myself, I don't really have a lot of knowledge about endometriosis. So before we start talking about your company, what's endometriosis? How does it affect women? What's the typical diagnostic and management, process?
Yeah, so endometriosis occurs when endometrial-like tissue grows outside of the uterus. So it's not the same tissue which grows in the uterus, but very similar. And it usually grows in the pelvic area. So most typically in female reproductive organs. But it can grow also in other places like a diaphragm. It exists. The brain, even they found it on the brain. So it can grow. It can grow literally everywhere. But mostly it's around the pelvic area. But in my case, all my organs in my pelvic area had endometriosis, which was stage 4 by the time it was diagnosed. So it can be, like sometimes women don't even have symptoms when they have endometriosis, but sometimes quite severe. And I had quite severe symptoms. And still, the most typical diagnostic method for endometriosis is laparoscopic surgery. So 10% of women suffer from this disease, 190 million worldwide, which is a really huge number. It's like type 2 diabetes or migraine, right? But everyone heard about migraine or type 2 diabetes, I think. But still, we need surgery to even diagnose it, right? Some doctors actually can diagnose it with different imaging methods, but it really depends on the localization of the disease and the expertise the doctor has, right? And of course, as so many women have it and such few experts can even diagnose it, then, you can imagine how big the problem is. And it has several comorbidities, mostly gastrointestinal. That's very typical, like irritable bowel syndrome, mostly during period and ovulation, but can be all over the menstrual cycle, and many other comorbidities. Now we know that also affecting mental health, but basically all body systems.
And the typical management system is hormonal surgery, like.
Yes, so surgery is needed when, of course, someone suffers from pain, and usually that's the solution. But yes, hormonal treatment. So there are the contraceptives in a sense. But the problem is that many times these women get prescribed estrogen-dependent hormones, and that's really not good because endometriosis is an estrogen-dependent disease. So it actually usually makes the situation worse. So usually hormones which don't have estrogen in them are the best option to treat endometriosis. But I wouldn't even say the word treat,
Manage.
because this is not management. It's not really definitive treatment. But yes, they can make actually like a women's life better, these hormones, but sometimes they actually have quite bad side effects. So some women actually stop taking them because of this, because the side effects are worse than endometriosis symptoms themselves.
I see. And it does affect your chance of getting pregnant, or does it affect that too?
You cannot, like, so for example, endometriosis many times get diagnosed after the age of 30 in the Western world. And why that age? Because that's the time when we try to conceive, right? And many women go to the doctor with infertility, and infertility occurs in 50%. 50% of infertility occurs because of endometriosis. So that's also a really high number, right? And in many places in the world, as women have children earlier, they don't get diagnosed with endometriosis, and it seems like it doesn't even exist because, like, they get pregnant much earlier. So that's when women get diagnosed many times over the age of 30, already presenting with infertility.
Oh wow. So your company, EndoCare Therapeutics, right? It's trying to devise, as I said, like a non-invasive diagnostic tool. Tell me about your company and what goals do you have with it, and how did the idea even came about?
Yeah, it's rather funny how the idea came. So I went to a conference last February, so just over a year ago. And I presented about mental health at the conference. It was a Marie Curie Fellows conference, so it wasn't my specialty, but just like we have a yearly meeting or Marie Curie Fellows, and I usually go because it's really nice. And then Ryan Windsor, who's the business advisor of my company, he came to talk to me, and he was like, "Why aren't you an entrepreneur?" And I was like, "I don't really know what is that. Please elaborate. I'm an academic." So this was my response. And then we started talking, and then he was like, "Do you have any ideas, like, for a company or something?" "Yeah, I have several ideas, actually. Let's talk about them, but they're mostly academic projects." And he's like, "They are not academic projects. They can be, like ideas for a company." So this is how it started. Like, I was already working with endometriosis, and I'm really interested in treatmental comorbidities, but I feel like we need to start with diagnostics, because if we don't even have a diagnostic method to diagnose this disease, like, how can we even talk about treatment, right? So this is where we need to start. So this is why this is the first big project for my company. But yes, we are planning many other projects, and I'm also running academic projects in the topic. We just applied for a grant about pharmacogenetic guided endometriosis therapy. So we are doing many different projects, but diagnostics is definitely in the focus now, because this is where we need to start. Diagnostics is therapy. That's the first step of therapy.
And so what's the rough timeline you have for your company? How long do you think it will take to bring the device to the market? And
Yeah, so my timeline would be already, but obviously that's impossible. So what we are doing right now, we are testing the first samples. And I would say that we can be on the market by 2027, 2028. I think that's the earliest realistic timeline. The reason why is that we need to have a minimum viable product first, which I hope to have by this time next year. And that's fine, but after we need to do clinical trials, and that's the trickiest part, because it's expensive. So we need to have funding for that, and it usually takes time. And not to mention our regulatory strategy that we need to apply for FDA and EMA clearance, and usually it can even take years. So that part does not depend on me. But first, we want to be in a market in the US and in Europe. These are our biggest market at this point.
You don't have to disclose any confidential information or trade secret, but I'm curious, when you say non-invasive diagnostic tool, all I'm thinking about is testing for biomarker. Is that how you guys plan on tackling the problem?
Yes, so we are testing biomarkers in blood. So it's as non-invasive as possible for endometriosis. But yeah, I'm not disclosing the exact biomarkers because of IP issues. But our goal is to have also like an affordable option. Because what happens nowadays, I think everyone is talking about NGS and the AI, which is wonderful, right? And I think, that's where we are in the field of genomics, and I think that's great. But I feel like for endometriosis, we don't even have a basic diagnostic method. So I think that's the best way to start. And our reason for that is that we want that all women would be able to afford this diagnostic method. And we also want governments to be interested in buying it. to be included in the public healthcare systems in Europe and also the private healthcare systems here and also in the US. So I think affordability here is key because 10% of women suffer from it. We don't, have a solution. And the other thing which I think is important that we are building a network with medical professionals, because that's one thing to get a diagnosis. But then what? So if no one helps you after getting a diagnosis, then actually it's even worse because now you know that you have the disease, but no one is treating you, right? You cannot even talk to an expert about it. So we are definitely teaming up with medical professionals, to kind of have a holistic care for endometriosis rather than just a diagnostic device.
Got it. And could you share the reason? Because usually whenever people start biotech companies, they start in the US, which is very obvious, right? Like there's a lot of VC fundings, there's a lot of capital overall, and it's also one of the biggest markets in the world, right? Like it's very easy to, but so I'm curious why your reasons about, launching the company in Barcelona, and how's the biotech VC funding environment is there, and what are the main benefits and drawbacks of operating out of Europe?
Yeah, so startup environment is booming in Barcelona. This is not it's happening since the last few years. So let's say since 2016, I believe that there are a lot of startups now. Like I think more than 2,000 healthcare startups in Barcelona, and it is just one city in Spain, right? So this is actually quite a huge number. And now they say that this is actually the second biggest startup hub after Berlin. So I think Barcelona is a great place to do this. I'm also since I'm, in this field and I'm not just an academic, let's say, I see this everywhere. I see a lot of startup events and a lot of healthcare startups around. So I think it's actually a great place to have this startup. Regarding VC funding, obviously, US is the best place in the world for VC funding. That I cannot really, contradict. But actually, I don't mind, to get funding from the US or other countries. So it doesn't have to be necessarily Spain. There are some VC funds also for women's health actually here, which I found. For now, we are still waiting a little bit with fundraising because we want to have the MVP. But yeah, I'm interested in whoever who kind of is interested in our technology, and then if we can agree, I'm happy about it. And I also, I don't know if you saw that, but I also was a funder in the Nucleate Global Program. Yeah. And we actually won an award, so I was really happy about it. It was about high impact research award. So I'm really happy that in 2024, finally people see that endometriosis research is high impact,
Yeah.
We finally reached this stage. So I got, training in basically the business around having a startup. I also talked to a lot of experts and VCs. So, I now have a bigger network of these people around me, which is great.
I see. And what's, you come from academic background, you're a scientist first and foremost, and switching to entrepreneurship, especially when, you weren't exposed to entrepreneurship or that environment when you were in school. It's a very significant transition, right? Because there's so many things involved, from finances to intellectual property to raising funding to leading people. What are the most challenging aspects of starting and running a biotech company, and how are you adapting and staying informed and they're effectively involved?
Yeah, maybe this is a personal opinion, but I don't think academics really understand how the business world works. I mean, at least I didn't, and many people.
I'm hearing this. It's not the first time.
And I didn't, and many times, people around me were asking me but why aren't you asking for more salary? And I laughed. This is academia. I have this grant which pays me this amount of money, and that's it. So. I really didn't understand, but people also didn't understand me who were, in the business world. But we have to acknowledge that most people in the world are in the business world, working for companies for profit. So this is the reality. So I really think that academics should have better training in what's out there. Because many people who are studying at the university, they don't become academics. I think it's 5-10% who become academics. Maybe I'm even Yeah,
especially.
right. Exactly. Now, like the academic job market is even worse than the business job market, which is bad already. So, so I feel like we should receive some training, but I think that as other academics are teaching us, they also don't know much about the business world. So, it makes it this like it's like a cycle, right?
Yeah.
But I really believe that we should hear more about alternative careers, not just entrepreneurship, but working for a pharma company or like, any other thing. Because yeah, this was the most challenging part, that I had no idea like how to do a for-profit company, because I always been an academic. Um, and now like I went through Nucleate, which was extremely helpful. Really, I understand it much better. And we have Ryan, our business advisor at the company, the one who I met last year and who told me I should be an entrepreneur. And he also taught me a lot about business and he sent me resources. And so in my case, like I only need to start doing something, and then if I get into it, I'm gonna learn it myself. But in academia, I didn't have the motivation to actually start learning about this. But yeah, definitely was very challenging, and I didn't really understand how VCs are giving out funding. Like who are even these people? Why? It was extremely hard, and I again felt like I'm in a completely new world. I think even more than when I was changing field between genetics, pharmacology, and computational genomics. I felt like that there, but not like this, because not everything was new. But now I feel comfortable in it, and I really really like this, because again I'm really interested in how my research affects people, like society, patients, and I think this is the best way to actually have that effect.
I'm really curious about this. I might ask a couple of more questions. Because there's so many levels to that, right? Like, again, from you have the intellectual property, but you have to protect it. So you have to know the legal aspects, but then you have to hire people who know that. You have finances. So you probably need to have people who are like involved in dealing with finances. And then you can, you need to raise funding. You need to be operational. You need to be able to expand. You need to pitch. There's so much information coming at you at the same time. It's very overwhelming. What was your like approach in tackling it? Like, how did you like put it in different, like what's the right word? I don't even know. Like, how did you tackle that? Like, cause I'm thinking if I started doing something like that, I'd be like, oh, I'm overwhelmed. Like, what do I do? Where do I start? How did you do that?
Yeah, I did one thing at a time usually. So first I hired lawyers who were amazing actually, and they explained me, all about the legal stuff, like how to set the company up, like even that, like how do you even do that, So they helped me a lot with that, and they explained everything. And some things I don't need to know. That's the other thing, because there are people. I mean, I'm not a lawyer, so obviously there are some things I won't understand, right? So they helped me with that, and then. With the IP issues, I was lucky enough to get a mentor at Nucleate, whom I had meetings every 2 weeks with, and she's an IP lawyer in the US in Boston, and she's a scientist. She did her PhD, and then after she became an IP lawyer, and she basically gave me a lot of advice, and she explained me everything from zero. So I really really appreciate that, like both Nucleate and her advice. Because I feel like this was the hardest for me to understand, like when to protect the IP, like what does it mean to protect it? What happens if we do something else? Like, should we do it again? So all of these questions, but she explained everything, and we are still in contact. So she told me that we can also ask her advice, and like when we go to the market in the US, she can also help us with that. So I think it's all about networking. I feel like I already know this in academia. I did a lot of networking in academia. But now we have to do it even more. I feel like people who have similar interests, because also regarding funding, because like if you're on LinkedIn and you're connecting with someone, maybe that person is not an angel investor, but maybe they are connected to an angel investor. And if they like or comment on one of your posts, then that person will see it. So I feel like this is the most important part, networking. And once I think it's really hard to start, because posting, it's really hard, because liking things, maybe commenting even, fine. But starting to actually post, I think it's difficult. But I started one day, and now I'm doing it quite often, and I'm enjoying it, And like also people are interviewing me like you, and I think that's also amazing because then people listen to what I have to say, and then that's more networking. So definitely this is the key, and through networking you can learn a lot,
Yeah.
because you connect with so many different people from so many different backgrounds, because it's not just scientists anymore, but I had in academia, who are amazing. Don't get me wrong, but I think in the business world you need much more than that.
Well, I really hope this conversation provides more exposure. I really, really do. Um, I think what you're doing is a great idea, and it's gonna change a lot of lives, hopefully. Um, Going back to what you said is that academics don't really know how to deal with entrepreneurship, how to approach it, even when they get being taught by other academics. Besides things like Nucleate, which is, I believe, is student run, kind of like a biotech accelerator, right? Um, what other ways do you think like entrepreneurship or exposure to entrepreneurship can be incorporated in education, whether it's at undergrad or at PhD level?
Mm-hmm. Yeah, so for example, like you're at Yale, and then there you have the Yale Biotech Club. I know you're part of it. So like I think these kind of things are amazing, but I think they are mostly available in like the best universities like Harvard, Yale, and all of these. I don't think they're available in any university in the world. But I feel like there are also a lot of courses online made by these universities, which are for academics. I just came across some of them online. So I feel like you can do this without being at Nucleate or without paying a lot of money. I think it's possible because there is so much information out there on the internet. But you're right about the fact that this is not involved in the university curriculum. So how do you even start, right? So I feel like being on social media helps with this as well. Think about LinkedIn and Twitter and some other places, because there you can see a lot of people who are not necessarily in your cycle, and then you can read about concepts, and then if you're interested in the concepts, then you can look for it. But I definitely think that all universities should have courses about this, not just Harvard and not just Yale, but all of them, because as we mentioned, so few people stay in academia after studying, even in the biology related fields, right? And we have no training in how to work at a pharma company or like any other company. And I see now that many people do these trainings on LinkedIn. So they offer like academics who were academics before, and now they're working for a company, and then they're helping out academics who want to leave academia. Even this saying leave academia is just changing a job. You don't leave anything. You're still a scientist, just in in a different place. And I feel like there is also stigma in academia about this. So if someone wants to be an entrepreneur or wants to work for a company, they're saying, oh, you weren't strong enough to stay in academia. But this is not about this. It's about wanting to do something different. And I still love being an academic, and I am an academic, and at the same time and I'm an entrepreneur. And I think these two things are fine together, right? So we kind of have to change how people think about this at all, and I think that's where we need to start.
Super fair, super fair. When it comes to raising funding, um, it's very hard to raise VC funding. There was a boom during the pandemic market when the COVID vaccine and the mRNA technologies were like really booming. So like the funding wasn't very available. But overall, it's hard to raise VC funding, and especially hard when you're raising funding for biotech companies because it takes a while to bring it to the market. There's also like usually higher levels of failure compared to other, let's say, B2B SaaS software companies. Um, what's your approach to raising funding? How do you approach pitching? Yeah.
Yeah, so as I'm an academic, I know how to write grants, and I think that's really good because like grant funding can be amazing, right? Because like you don't have to give away equity, and I think in the early stages of a company, this is essential because many times you get low amount of funding from VCs, but you have to give away a really large percentage of your company, right? Immediately, like have such a large dilution. So we are applying for grants. Some projects I'm doing in academia, and I also talked to this IP lawyer about, how to license the IP eventually, because, we kind of sometimes need to use university resources which are already there. Yes, there are some grants which are specifically for companies which are also very competitive. But I won competitive grants before, so we are trying all of them. And on the other hand, I'm also interested in angel investors, like people who have endometriosis. They know someone who have endometriosis. They are patients, So I think that's really the way to go now for us. VC funding, I think, in later stages would be the best option for us, both because we are a very early stage company, and was both because of dilution of equity.
In your opinion, what are some myths and truths associated with being a founder? And since starting your journey, what key lessons have you learned? And if you could go back in time, what would you do differently?
Yeah, so I think my fears are also coming from my cultural background. I'm from a country where entrepreneurship is not really a thing. Or like there are some people who, I think you understand what I'm talking about.
Yeah.
It's like you work for a company maybe, but you don't really do it yourself, or that's not really in the culture. Even some people do it, but still not, they're not encouraging you to do that. Not like in the US, but like they are encouraging you to do this. So that's why I had this fear for a very long time. And my husband, for example, he was encouraging me to be an entrepreneur. He thought that I have it in me since a very long time, but I had the fear, really. And what if it doesn't work? Then nothing happens. If it doesn't work, then I will have another idea and that will work, right? But I believe that this idea I have is going to work. Actually, I do believe, I'm certain that it is going to work. And I think this is also a great motivation when you start a company, that you literally, like, you really believe in what you want to do. I think that's essential. So yeah, I think everything, all the myths I thought about being a founder comes from my cultural background, I would say.
What are some truths?
Some truths, that it's really hard. That it's true, it's really hard. You feel like lost at the beginning, and then you are hearing these statistics that 90% of startups fail. And then you are like, 90% is high. But then you think about it, that you are, as an academic, you got funding which had 6% success rate, and you're like, oh, actually, that's very similar. It's even worse, So yeah, it's very, very difficult emotionally, and then you suddenly became, because I'm a CEO of the company and the founder, so I suddenly became the boss, So then you need to decide what to do, and other lives also depend on you eventually, and these are really, really hard things. So I would really agree with people who say this is a really hard path, but it's also amazing at the same time. So that's why people do it, right?
Exactly. If you could go back in time, do you think you would do anything differently?
I wouldn't say, because this is still a very early stage startup. So please, ask me about this in a few years, and I'm sure I will have better answers to this. Now I'm with the optimism of an early stage company, and I think I need to use this optimism to work and to reach my goals as my fuel. But I will definitely have things which I would have done differently. This is the first time I'm doing it. This is the same in my academic work. Whenever I changed the field where I worked at, I always failed.
Yeah.
We have to fail to be successful. So I'm expecting fails. Yes. So please ask me later.
No, 100%, Dr. Koller, and I'm pretty sure it's gonna work out. Your idea is really great, and it's just it's really, you're really trying to change a lot of lives, right? And that's really important. So I really hope your company and your idea succeeds. We're near the end of our podcast, so I'm gonna ask my final question. There are a lot of young, aspiring entrepreneurs hoping to venture into entrepreneurship, right? Especially from science, from academia. What advice would you have for them? How they should approach it, especially when they are still young, still in school and doing their PhD?
I would say believe in yourself and believe in your idea, which I already mentioned, because without that, you cannot do it. If you don't believe in your idea 100%, it's already so hard, and many people will try to tell you, I don't think it's going to work. you know. But if you don't believe them and you pursue your idea, I think it can be a great motivation. And I think everyone who actually wants to be an entrepreneur should try. Because as I said, you will fail, and maybe your startup will fail, and maybe you will change your mind, and maybe you don't want to do this anymore, but that's also fine. We can change our interests, right? I wanted to be an academic forever, and I still want to be an academic, but I also want to do something different. So this is what I would say, that go for it, and then if you fail, nothing happens, you know.
Dr. Koller, this was a very fun and informative conversation. I really, really appreciate your time. Thank you so much. Again, I wish so much luck to you and your company. And, hopefully everything goes well and succeeds, and we get to have another conversation again in a couple of years.
Thank you so much. It was great talking to you. Thank you for having me here.
You have a great day. All right.
Thank you.